disclosure. Tools are a lot of balloons and atherectomy and my knowledge. For balloons, you got to pay attention when the procedure is being done, what wire they're being using, how long is the leashes, and for instance, sometimes the balloons have the same size but different wires. Also, how long it is. Sometimes some balloons don't have the same length. For instance, the taper balloon, you can use very long leashes, okay, almost cover the whole leg, depending on how tall the patient is. You can help the patient with that. So you use less radiation, less contrast, and you help the patient a lot with that. We have Medtronic. That's the one who has the taper balloon. We got Terumo, Abbott, Cook Media, Medical, and Cardinal Health, Gord, and Androtech. Okay, over here they show you also for the, concentrate this one on the critical limb, where the balloons do the most work for the patients. Like Dr. Singler pointed before, critical limb also use, help them to the, help them with the, what's that word? Revascularization. Especially when the patient going for amputation, this is the best part for the patient. Stents. You have a Supera, you have a Absolute Pro, Biovan, and Protégé Eberflex. For these stents, usually doctors, they see the angiogram first, and also they use the, like Dr. Murphy suggests, use the IVUS, where they will tell you which one to use it, where. Also, it's only studied how long these stent will last in the patient and what's the benefits of it. Inclusion in the intermediate term treatment of superficial femoral artery disease by a primary implantation of a self-expanding internal stent. Yield results that were superior to those with the currently recommended approach of balloon angiographic with the optional secondary stenting. Carrying balloons, very interesting. The chocolate, the Ultrascord, Serenator, Flexstone, Wolverine, Angioscope. Some institutions don't carry all these kind of balloons. We are lucky in our institution, we carry most of all these kind of balloons. Also, you gotta know the length of each balloon, depending on what the doctor we need. Sometimes they ask for things we don't have it, but you need to be aware of what we have on the shelf. Shockwave. Shockwave is a great balloon that can be very helpful to the peripheral area. They recently also got approved for the coronary, which has been very helpful also. In the peripheral area, we usually mostly in the TAVR, which we use was very helpful to the iliac, where the after that review the CT angiogram, they see where the size of the artery, how much calcification is there. So from there, they determine that whether use of the shockwave balloon, where it will help them to break the plaque, so they can go through the larger sheath, so they can deliver these things. And that is the valve. The original atherectomy device from Medtronic. They usually use this one for the SFA and below knees. There's a little demonstration of what they do. They go into it and they get some the plaque scraping through it, artery. There's so much data that will show you the result of this using this kind of equipment. We got a laser, now it's owned by Philips. For all these kind of devices, you should know also how they work. Sometimes doctors, they're being trained, and you should train them also on how it's being used. Or you also, as a tech or as a nurse, some institution, the tech is the one scribing, or the tech is the one who's open the equipment. Same thing with the nurse. You should know how they work. Sometimes the doctors go too fast. Yeah, let them know, slow down a little bit. There's some result from the statics. The curve repetition there. Rotational atherectomy device. This is the one where you really have to be very careful. You as a tech or as a nurse to see if that the lubrication will be all there, then also the suction part of this device will be working. Be mindful of the patient. Also, they complain with this kind of this kind of device. For this device, if you don't know anything about it, sometimes it is good to speak with the reps. The clinical rep, they're always available. They're very friendly. At least in our institution, they're always available. Reach out to them. Just repeating it. Also, you should know also how to prepare all this machine for the jet stream. Make sure they have the equipment also. Lipsing experience. It started was a single-centered retrospective analysis. Total of 658 procedures study. Use of the Rotatex device in native. And also, US Tech also should be able to identify the anatomy of the patients always to see any change also, because sometimes the dot is concentrated in one area and don't see the other, and you should point it when something has changed. over to atherectomy device. It's a rotation device to go inside the artery. I'm sorry, guys. All right. There's a lot of information for you guys. You can read it. But the main thing is the patient. Sometimes people forget you have a human being at the table. First thing the patient sees is you. At least in my case, it would be the tech and the nurses. They don't want to be there. Treat them like a human being. Treat them like it's a part of your family. They always care. On my case, I work with a great team of nurses and nurse practitioners, doctors. Sometimes you get a lot from the patient just speaking to them. Sometimes they go their blood pressure 200. You speak to them, compare it down to 150, 120 without medication. Sometimes you get information, you can pass it on to the doctors where it will be very helpful for the procedure. For the text part, try to read the clinical before the patient go on the table. It will help you to organize yourself, what kind of equipment you're going to use, what kind of balloon, what kind of atherectomy. All this information the doctors show you today and the nurses, it's available for you. Just read it and it will help you to help the patient. And remember, you get a paycheck from the hospital, but you work for the patient. Some people forget that. Thank you.